Thank you very much, Mr. President. I want to just talk very briefly about two or three things. First, the issue of testing and how that has really changed the complexion of the approach that we're going to be able to take. Testing was an issue. We had many questions of testing in this room for a number of times. Now that we literally have hundreds and hundreds of thousands of testing out there, there are a few things that we can do with that. One of the things is that when we make policy about what we're going to be doing with the rest of the country, particularly those areas that are not hot spots, we need to know what the penetrance of infection is there. So we need to put a light on those dark spots that we don't know. We have to act policy-wise on data, and we're going to be getting more data, a lot more data. The other thing is that the areas of the country that are not hot spots, that are not going through the terrible ordeal that New York and California and Washington State are going through, they still have a window of significant degree of being able to contain. In other words, when you test, you find somebody, you isolate them, you get them out of circulation, and you do the contact tracing. When you have a big outbreak, it's tough to do anything but mitigation. We have an opportunity now that we have the availability of testing to do that. So you're going to be hearing more about how we can inform where we're going, particularly because we have the ability to test. The second thing is I just want to reiterate what Dr. Birx said about New York. It's a very serious situation. They've suffered terribly through no fault of their own. But what we're seeing now is that understandably, people want to get out of New York. They're going to Florida. They're going to Long Island. They're going to different places. The idea, if you look at the statistics, it's disturbing. About 1 per 1,000 of these individuals are infected. That's about 8 to 10 times more than in other areas, which means when they go to another place, for their own safety, they've got to be careful, monitor themselves. If they get sick, bring it to the attention of a physician, get tested. Also, the idea about self-isolating for 2 weeks will be very important because we don't want that to be another seeding point to the rest of the country wherever they go. And then thirdly, just one comment about drugs and the testing of drugs. You know, you heard yesterday about drugs being out there that physicians on an off-label way can prescribe it to give people hope of something that hasn't been definitively proven to work, but that might have some hope. I don't want anybody to forget that simultaneously with our doing that, we're also doing randomized clinical trials on a number of candidates. You've heard about candidates, but there are others in the pipeline where we'll be able to design the study, and over a period of time, particularly since we have so many infections, we'll be able to determine definitively, are these safe and are they effective? We're talking about remdesivir, other drugs, immune sera, convalescent sera, monoclonal antibodies. All of these are in the pipeline now, queuing up to be able to go into clinical trial. So I'll stop there and talk.
Thank you, Tom. Great job.